You're listening to the podcast Coffee with Mike and Julie, Libertarians Talk Psychology. This is current commentary from an MBA businessman and a PhD psychologist.
Look what they done to my song, Ma.
Is our medical system meeting our expectations? Have they led us properly in responding to the coronavirus? The answer might be no to both of these questions. I want to recall to you the relationship we had with our doctor, Dr. Giddin in Baton Rouge, decades ago now. And he's no longer practicing, and we won't get into why that.
Well, we don't know that for sure, but anyway, he got into trouble.
I tried to look him up. I couldn't find him.
He got into trouble, and it's heartbreaking because he was one of the best doctors I've ever had in my whole life, and he was fabulous.
We loved him because he worked with us. He was not.
He's also extremely smart.
Well, he knew his business. He was very willing to compromise with what we wanted and stay within his level, his expertise on the subject.
Yeah.
He was a consultant to us.
Yeah, I could bring in an article, and he'd review the article, and he'd say, which you never hear physicians say, I don't really know about this, but I'm willing to work with you to see if this helps you.
That's right. He would
collaborate.
Help do a little collaboration.
And he'd appreciate the research.
And then on top of that, I used to be embarrassed because he'd have people out in the waiting area, and he and I would be bullshitting, and he might make those people wait 30 minutes while he and I are sitting there. We weren't even talking medicine anymore. We would just be bullshitting.
Just be having fun together.
That's
I mean,
right.
he did have that trait, which physicians have, which is they can let people wait for hours without any kind of guilt at all.
But it reminds me of a little research I heard yesterday, and I can't even remember what podcast I was listening to. But they talked about the importance of a personal relationship with the doctor and the quality of care that you get. They were really talking about a racial thing, that black doctors have a better relationship with their black patients than white doctors do, and
than what white doctors have with black patients.
Right.
Yeah, and that's very predictable.
And it results in better medical care. A lot of it because the black patient trusts the black doctor that they have a relationship with.
Yeah.
And
well, they trust them because their understanding is higher.
But it ends up being a measurable result in the quality of medical care that the black patients get. But of course, you and I think it's true about anybody. You have a relationship with the doctor, you have a cooperative relationship on your medical care.
And trust between people is a factor in everything. And then you got the trust factor, you got the just knowledge, understanding factor, which of course adds to the trust factor. But the other thing you got with a physician you trust is you have a strong mind-body, or what's often called erroneously placebo effect. But you get a lot more benefit from every treatment. I mean, we haven't tested every treatment, but any treatment is likely to have a lot more benefit if you like your provider, because you engage the synergy of the mechanisms in the body. And they call it placebo. It's really ridiculous to do these double-blind studies and eliminate it as error. It's not error. It's synergistic use of mind-body phenomena.
In other words, placebo effect does not mean it's not true.
Exactly.
Placebo effect can be a very positive, lasting
treatment effect.
What it really is the power of your own mind.
Yes.
To help you with what you have, the power of your own mind to help you.
Yes.
And they called it a placebo because
it's not the right term. The term says it's imaginary. But the mind-body effect is well documented. But when a healer can engage that, I mean, you can. I don't want to say I know all the specific statistics on it, but it's a strong effect. It's a strong effect, and sometimes it's the only effect you can get. There's studies that show that a prescriber of antidepressants, et cetera, for mental health, that they only work if the person trusts the provider. That's interesting research there.
Wow.
I interviewed a guy on that who and I thought, holy mackerel! I mean, this goes deeper and deeper into our makeup.
So my reason for bringing this up is that with today's increased control over doctors and over medicines, that we don't have that personal relationship with our current
God,
doctors.
it's ripped away from all of us.
And it's a real loss. And now that we have this coronavirus stuff, and you and I are thinking of, gosh, I mean, the research is still unclear. There isn't real good research on anything yet. And we would like to have that cooperative relationship with the doctor in case we get this coronavirus, because we're over the line of the age group where it's
we're
safe.
We're over 65. So we were, well, let me just repeat what we did. So we're trying to, what if we get it? What if we get it? What do we do? And I'm thinking, I definitely want to be on the hydrochloroquine as a zinc ionist for method, that protocol that the New York doctor Zelensko uses. That's the protocol I want to be on if I get it. So we call around in Milton, Florida, and we find out that there's not a chance in hell that we can get that protocol, because they don't touch us with a 10-foot pole. If we're suspected of having the coronavirus, we are automatically sent to a hospital who will test us and let us sit on it while it incubates in us, by the way, because the first 7 to 10 days it's in its incubation stage and it's growing like wildfire in some people, and some people it doesn't. But if you don't have a strong immune response, innate immune response, it gets one up on you, and then you go into the hospital and you're in trouble. You're in trouble by that time. So we found out that there is no early treatment for this allowed.
Right. And it's a real loss. And of course, I blame it completely on the increased governmental involvement in the medical industry.
Yeah, from a libertarian standpoint.
Between government regulation and the pharmaceutical industry colluding with each other and getting more and more control, and then we get Obamacare, and now it's even more control, so that these doctors they aren't even talking about anything creative. I mean, their
hands are tied.
And then the insurance companies are in on this. They're under fairly tight control. It used to be doctors were pretty.
They had a lot of freedom.
Loose rein. Had a lot of freedom.
They had a lot of freedom, and they have a government body. I mean, the depth of cheating and corruption and what should we say, motivated reasoning is so high in that system. So let's call it the medical pharmaceutical hospital system. I think that it's ridiculous for any citizen to think actually they can get good health care. These people that go, oh, well, Obamacare is so great and the thing we had before is so bad. It's all bad. It's all bad. It couldn't much from a libertarian standpoint, and from a system standpoint, it couldn't get much worse that I can see. I mean, so I reported on this in Louisiana, and of course I've been reporting on this from a systems view. It's an absurd system. The medical profession, the pharmaceutical profession, the hospital profession gets together with the government, and they decide everything in these secret groups for the CPT codes, CPT codes, like what you can treat and how much you get paid. And then there's a secret organization for the relative value of things. So they set the costs, they set the price. They price fix, and how that's legal, I have no idea. But they decided it was legal. I mean, this is a Gestapo level secret society. And so they get together, and so in one of my reports there was this study that found in Louisiana that the amount of money paid negatively correlated at 0.9, which is almost a perfect correlation to the healthcare outcomes, to the health outcomes. So the way you interpret that is that you should probably do the opposite of what the system tells you to do, and you'd be better off. Because if you do what they say, your health outcome is almost completely the reverse of what you want it to be.
And it was a negative correlation between the outcome and the
cost. And the cost, of course,
so the money spent.
The costs skyrocket because of the hospitals. The hospitals have like a monopoly on things, and they're these big outfits that spend this enormous amount of money on a lot of procedures that have dubious benefit, and they're almost always better, less invasive and aggressive techniques available that have better outcomes, but those are hidden from the people. And I think they're hidden from the doctors.
So tell us your statistic on deaths, and I'll mention the story about Walter.
Well, this is Markey. This is a doctor who's been following, a physician that's been following this for a while. I think his name is Markey. I don't know, but anyway, I have his book, and I think it's accountability. But anyway, when you look at this, and this research is not considered to be accurate because they hide this. They hide stuff from you. The death certificates are squidgied with, but that medical error is the third reason for death in this country. So the first reason I think is cardiovascular, and I think the second is cancer. Now those two, the best treatment for that is behavioral interventions, both of them. I mean, cancer too, because it's really obvious that cancer is a toxicity problem. Now, you got genetics in there too, so you can't say that somebody's doing something wrong. But if you're going to try to stop cancer, prevent cancer, you want to get on behavior. You want to get the behavior correct. Even the psychology is involved. But the third cause is getting medical help. It's like,
so I'm gonna add my heartbreaking story about my good buddy Walter, who we used to have coffee every week, and we'd shoot the breeze for hours. And would just have a great
such a great guy, such a decent man.
But he had a minor surgery, which he did in the hospital, and I can't remember if it was
something with his sinuses. It was minor, but it was also it wasn't required. It was optional surgery.
Well, I can't even remember exactly what it was, but I think it was his nose. But
sinuses or something.
After that surgery, he turns up this, I think it was called MRSA. This dangerous infection
deadly
that
infection
you typically only get in the hospital.
Superbug.
And he lived with it for months, but it never went away, and he finally died from it. And it was heartbreaking, and I spoke with...
It was unnecessary death.
I spoke with his attorney's son about it and said, this was caused by the hospital. This wasn't even necessary. And from a legal standpoint, he said, "Oh no, there's no chance in hell that there's any responsibility, because they can claim this has been challenged many times. They can claim that he could have gotten it someplace else, that he couldn't. It's not necessarily true that he got it in the hospital, but it's so clear that that's what happened."
Of course. And people need to understand that when they go in for for optional surgeries of any sort, that they are risking these superbugs.
And that
Because those
brings up-
hospitals are breeding grounds. They're petri dishes for these things.
But it brings up the way the system works, and this didn't just the medical system. This is anything where government is involved with their regulatory way to do business. Is that the hospital did the normal and customary treatment on Walter.
Yeah.
And when government designates what is normal and customary, then the court system
Has no option.
is handcuffed. There's no option.
Yeah.
They're not responsible because
Yeah.
after all, they did what the government said is normal and customary.
Yeah.
So there's no, you don't even have the option
Yeah.
of pursuing them.
Yeah. So the cheating is rubber stamped as okay.
That's right.
Yeah, so yes, what happens with a monopoly, and that's what we have in healthcare, is we have a monopoly and we have a complete negative correlation to health. That's why the U.S. ranks so low. Well, let me bring in another part of the psychology of it. And this is the libertarian philosophy, but we know, I think there's let's see, what is it called? Self-determination theory. There's a whole theory about this in healthcare, is it that when you engage and empower the patient through supporting their autonomy, which that's libertarian, and their independence, that's libertarian, and their responsibility, see, that promotes their options, that promotes their freedom to choose. Okay, so all that's the libertarian. When you do that, you get much better health outcomes, because otherwise, you have this kind of like dependency model where we go to a physician to get our health, and the physician is all knowledgeable and has all these great drugs and all these shortcuts to health. By the way, there's no shortcut to health. The long road is the best road, and it takes a lot of discipline and time. So we take these shortcuts, and then what do you know? The physician gets paid, not much as they need to get paid, but the hospitals get a lot of money, and everybody. There's a whole system of profiteers, of profiting. Band-Aids cost $10 and ridiculous stuff like that. But that requires enslavement of the customer to keep them out of the information flow, to keep them dependent, to make them think that there are cures that aren't, that in actuality aren't cures, they're just symptom treatments and you never get cured. All of this is the game.
Talking about the information flow, the thing that pops into my mind is, it used to be you knew how much it cost to go to the doctor. You don't even know anymore. I mean, they don't even pretend. If you ask the receptionist how much it costs, she doesn't know.
She will tell you, we just charge your insurance. Now, here's the thing, Trump did, and I reported on this. He put forth some executive orders that said everybody has to be transparent about what this stuff cost. Okay, now, I have looked to try to find out now where are they posting it, and they're trying to dodge the principle of transparency. They're still trying to cheat.
Oh, yeah.
But he did what he did something to notice that the information flow is designed to keep the consumer deaf, dumb, and blind. So that my philosophy, which is a hard line philosophy, I dropped that weight on my foot. Remember that? Dropped a weight on my foot, and I broke a blood vessel in my foot. It was clear because my foot blew up with blood.
It was clear to you. I thought you should have gone to a doctor.
Okay, and I refused to go to the doctor because why? Because I knew the damn weight. It was like a round weight, and I knew it sliced a blood vessel through pressure. It broke a blood vessel. What are they going to do? Operate? No, I don't think so. So I'm gonna. I'm not going to go to the doctor. We had a little fight about it. But it's like, there's nothing they can do for me that I can't do right now. You're going to put me in the truck. We're going to drive 30 minutes. We're going to wait in a waiting room. I've done that. This wait in the waiting room is ridiculous. when you have an emergency. I mean, what are they going to do? So I did what I was supposed to do, knowing the diagnosis. I did a better job at healing that foot than they could have ever done for me, by the way. I mean, just so you know. Do you agree with me now on that?
I agree with you now, but you were just lucky. You
I was
didn't know what you were doing. You have no expertise in.
I'm a critical thinker. I do know exactly what happened. It wouldn't have, just dropping that weight on my foot. There was only two things that it could be. It could be a pressure. It could be a when you hit something and it swells up, you've damaged the soft tissue. I didn't really damage much soft tissue. That thing made a cut underneath the skin in a blood vessel.
Okay.
What else would it be? By the way, process of elimination.
I don't know. I'm not a doctor.
Well,
I don't pretend to know. I want to go to
You want to go to the
more expertise than you do to help me make that decision.
See, you're not really a true libertarian if you don't realize. A true libertarian with my judgment about what happened is just as good as the judgment of some physician.
Well, I'm glad you made that statement, because that's the problem that we've been forced into. As government has gotten more involved in healthcare, we no longer have the option of going to an expert that we have a personal relationship
that we trust
and that we can work things out with.
Yeah.
And what has happened is the burden is on us at an individual level to do our own research about, in this case, coronavirus and the research
Good
that
point.
goes into the coronavirus. The responsibility is on us at an individual level. They've taken away our consultant that we used to have. They've taken that away from us.
I agree with you very much that we used to, like with Giddon, we had a consultant who had a large knowledge base. Okay, so we consulted. We didn't give up our responsibility to understand our own body, but we had an expert we could consult with.
Now, let me say this. I'm going to touch on his getting in trouble. He had a little tendency to work a little too much with people who took advantage of him.
I think he got manipulated.
He got manipulated
and gave out too many
drugs.
But
he had a little tendency for that. He would work with people and help them get a drug that they really didn't need that much.
Yeah, he wasn't a hard ass.
He wasn't a hard ass.
He was a friendly cooperative. Your point is he might have been a little too cooperative and gave in a little bit to people trying to pressure him.
And then someone got pissed off at him and turned him in.
Yeah.
And the medical community came down hard on him, and that was it.
Yeah. So we think highly of him. And so back to the issue from the libertarian standpoint is the complete, almost worthless information coming out for the individual about the coronavirus. Okay, let's point out the idiocy so far.
And let me point out, so now we're getting into the research side of the medical profession and the quality of research in order to make decisions.
Well, actually, I was going to start at the very beginning.
Okay.
They at the very beginning, it was so obvious for any clear thinker that the thing was transmitted airborne. So you don't spread through airplanes by surface contact the way this spread, because that would logically mean that people had to pick it up on some surface and put it in their eye. And the people coming off the planes were there was a fourth of them ill, and then it spread into the communities and the nursing homes and the church. However it spread, it was so clear it was airborne. Oh no, it's not airborne. We don't think it's surface. And wash your hands, because you can't wash your hands and protect yourself from an airborne virus. You wash your hands to protect yourself from taking the surface connection and putting it in your eye. They have been wrong at every step. Oh, the mask won't help you. Oh, wait, a mask will help you. Oh, wait, a mask won't help you. Don't use the mask because we need to save those for the frontline workers. I mean, the stupidity coming out of the, what should we call this, group think that goes on. Because, see, this is where the psychology of decision making and judgment. You put a group together and immediately, especially the government people, you put this group together and immediately they become arrogant. And when they become arrogant, they become self-deceptive. And when they become self-deceptive, the quality of their thinking goes way down.
And I'm going to use the word speaking with certainty. Because if they would just qualify their opinion a little bit, then we could understand what was going on. But every step of the way, they speak with such certainty. Confidence and certainty. And they kind of seem to feel like they need to, because after all, the government has designated them the scientific representative who's supposed to know everything. So they speak with certainty about the masks and how it spread and how many deaths we're gonna have with the model, and they speak with certainty about it, and they don't know what they're talking about.
Well, I agree, and see, that's a sign, when someone's overconfident, that's a sign that they're in self-deception. And it's also really well documented. That's hedgehog thinking instead of fox thinking. As far as solving a problem, it's better if you're a fox, flexible, keep your boundary open for new information, keep some kind of concern with this might not be right, where a hedgehog is, I'm right, believe me, trust me. The hedgehog drills down, this is Philip Tetlock's work. The hedgehog drills down, becomes more and more certain of their decision. So we get that, and there's the psychology is kind of complicated. There's a reciprocal. We want our experts to be certain. In a dangerous situation, we want certainty, so we foster that in them. And oh my God, does the media complicate the decision making like pouring gasoline on a fire?
And let me add to this language of certainty that we keep getting, that's frustrating to have to listen to. First of all, if they could speak with certainty about what they really know, then that would be different.
Yeah, that would work. If they could say, we're not certain about this, but we're pretty certain about this.
Right. But the thing that really kills me is they speak from a scientific standpoint and imply a certainty that is misleading. For example, when they say something like, there is no scientific evidence that hydrochloroquine would work for the coronavirus. There is no
evidence that this will work.
That's right. And they say it in a way that is conclusive, and you are supposed to conclude, hey, I'm not touching hydrochloroquine.
Yeah, let me expand on what you're saying. They make a statement as if something that, what is it called? The absence of evidence is not the evidence for absence. They make the logical error that because there's no evidence for something, then there never will be any evidence for that same thing. You and I informally call it the proving of the null.
Right.
So people who don't believe in God, they say there's evidence that there's no God. Well, you can't ever prove that there's no God because you can't test every single situation to prove God doesn't exist. I mean, there's just no way to prove something. Sometimes in our existence, you cannot prove the null.
Well, I hadn't caught on to that kind of certainty statement that I'm talking about was the same as proving the null, but that's exactly what it is.
Yeah.
When they say
we've proved the null, we've proved hydrochloroquine can't work.
You know, there is no evidence for that, implying that you shouldn't do that. But what they're really doing is they claim to have proven the null.
Yeah.
and which is impossible.
Which is it's an error. It proves they're
It's
not
a-
very, and I feel this way about Fauci. He goes in front of the nation and he says the gold standard, which you could say this is a gold standard, but the randomized clinical trial is not a gold standard for your theory. It's a gold standard for your hypothesis of that study. But it is one piece of data collection. It does not collect data on individual response, and it isn't going to collect data on the very strong effect of the relationship between the doctor and the patient's mind-body healing ability that we call sometimes placebo. So I know that there's a lot missing. Oh, and in individual responses. Because in the large randomized control, you're masking out individual responses. You got a nomotheic, if I'm pronouncing it right. You got a group response, which the pharmaceutical company loves because the profits are in the group. The profits are in the group. The profits aren't in the individual. Okay, so then you're completely wiping out the individual response. So it is not any kind of gold standard for your theory. For your theory, it might be a gold standard for your hypothesis.
And the implication when he makes a certainty statement about there is no evidence that is effective, the implication is, oh, you have a bunch of alternatives where we do have evidence.
Oh yes, we've got these high price.
The point is they do not have evidence that anything is effective.
You don't know what
all
they
he
have.
has done is told you, well, whatever you do, don't do that one because we don't have evidence for that one.
Yeah.
And he's neglecting to mention we don't have evidence that anything works.
Exactly. So let's look at all the flaws in the guy. Number one, he's scientifically flawed and he doesn't seem to know it. So he's got an arrogant thing.
Well, I don't know that he's the one that said that about hydrochloroquine.
Well, I heard him.
He has said it about other things, but I don't think I've heard him say.
Oh, I've heard him say we have no evidence that hydrochloroquine can do any good here. Well, and let me add, the other thing is if you actually go to the trouble to look at all these studies, unless I'm missing something, which I could miss something because it's boring to me now. It used to be I was pouring through all this evidence, but there are people who pour through the evidence that you can trust. The guy on MedCram is really very cool and very, very good scientific thinking and critical thinking. There's scientific thinking, but the thing you want in your helpers is critical thinking. That's what you want. So he's a critical thinker, strong critical thinker in my view. But so pour through the evidence. There is evidence that hydrochloroquine works, but at the beginning of the illness, and they have manipulated the information in a way that unless you're looking at the evidence, you don't see the manipulation. So this is unethical to mislead the public. And there are a lot of people misleading the public that the evidence is not there. The evidence is building. The evidence is there for this to work with at least some people. So it should be a tool in the general practitioner's toolbox under the right conditions. They continue to do these studies where they throw massive doses of hydrochloroquine at very ill people and act like that's a damn study. Now, I just feel like that's not unethical, but almost illegal. The unethical, misleading information is, it's stunning to me that the researchers who are doing this are willing. I don't know if they're morons or whether they're into self-deception and have a political agenda that's overriding any logical thought, or whether they're crooks of the highest order and working for the pharmaceutical. It's really weird. It shows to me the hydrochloroquine problem. It shows to me, convinces me of my don't go to the doctor when you drop a weight on your foot, because they're going to kill you. If you go into the hospital, you're likely to die from going into the hospital. The weight on your foot is a inconvenience for a week. You have to leave it wrapped and you have to ice it. But if you go into the hospital, they could kill you giving you something. But the hydrochloroquine issue convinces me that we are all on our own, and we all better, when it comes to the medical help, you better turn into a libertarian, because you are on your own. You're going to need to research your own health, research what your chances of dying of heart disease, cancer, dementia, arthritis. You better research do not trust anybody. I know that sounds paranoid, but it's serious problem here in this country.
Yeah. So we need to go ahead and wrap up. And so here's
sorry to get on that soapbox.
So it's okay. It's one form of wrapping up that I'm going to say, and see if you want to, if this is good enough. But from a libertarian standpoint, when this coronavirus thing first came out, I thought about, well, this argument that you need government for certain things and that individual freedom may not be the best way to address the problem. I really considered that, and now I am seriously thinking that what we're ending up with is a far cry worse than if individuals had simply been well informed and responded in the public. People like you and me could have been in the house taking care of ourselves. We could have.
Yeah, it's up to the individual, because each individual has a different risk factor.
I think maybe the result would have been a lot better if government had not gotten involved.
Yeah, I think I agree with you.
They have closed schools, kept kids who are in almost no danger from the coronavirus, kept them in the households.
Yeah, you get this over the moon response.
Wrecking businesses.
You may want your children to develop some immunity, because I don't know that we're going to have immunity to this thing. I don't know that. I mean, the whole thing's a moving target.
It's a moving target, and we still don't know. But I'm suspicious that it's looking like the libertarian method on this would have been a much better solution.
Yeah, okay, so let me say that I agree with you 1,000%, that the individual is the best place, and the constitutional framers knew this. The individual, an informed individual, is in the best position to protect their rights, not the government. And this is a great example of how the government used a one-size-fits-all battering ram to, guess what, protect the hospitals. The hospitals don't even have a treatment.
So I'll conclude with this statement. This battering ram that they did is the same battering ram that they used 1,000 years ago with every plague that we had, every illness that we had worldwide. In other words, we progressed almost nothing, almost none of our progression. We have used almost none of our science and technology to progress from what they did 1,000 years ago when some new disease came through. So this is really bad. That concludes this episode. Now for the footnotes. CPT code stands for Current Procedural Terminology, developed by the American Medical Association and maintained by an editorial panel. It is supposed to communicate uniform information about medical services, including fees. It's worth noting that Julie and I have always been suspicious of the medical community, as revealed by the fact that we chose home births for our children about 40 years ago and before it was cool. Philip Tetlock is a Canadian-American professor and philosopher. He is known for his work on forecasting.